Are some foods quietly making your amlodipine side effects worse without you even knowing? That's what we're breaking down today. Doctors prescribe amlodipine because it lowers blood pressure and protects the heart. But what you eat can make a big difference in how this medicine works in your body. And here's the reality. Most doctors don't go into detail about these food interactions during short clinic visits. The wrong foods can turn mild side effects, like swelling, flushing, or dizziness, into something much harder to live with. Stay with me, because by the end of this video, you'll know exactly which 7 foods can quietly worsen your amlodipine side effects, why they cause problems, and what simple swaps you can make to keep your treatment safe and effective. Just a quick note before we dive in. This video is for educational purposes only. It is not medical advice. Never stop or change your medication without talking to your doctor. For full references, check the links in the video description. Now, let's get started with the first food on the list. The very first food on the list is grapefruit and grapefruit juice. This might sound surprising because grapefruit is usually seen as a healthy choice packed with vitamin C. But for people taking amlodipine, grapefruit can cause real problems. Here's why. Grapefruit blocks an enzyme in the small intestine called CYP3A4. This enzyme normally helps break down amlodipine before it enters the bloodstream. When grapefruit blocks it, more of the drug gets absorbed. Blood levels of amlodipine can climb higher than your doctor intended. That extra drug in the system does not make it work better. Instead, it makes side effects worse. Patients often notice swelling in the ankles, dizziness, or flushing becoming more frequent. Some even experience unusually low blood pressure. Clinical studies confirm this effect. Researchers have shown that a single glass of grapefruit juice can significantly raise the concentration of amlodipine in the blood, and the effect can last more than 24 hours. So even if you only drink grapefruit juice in the morning, it can still interact with your medication later in the day. The risk is greater for older adults because their bodies already process drugs more slowly. This means grapefruit can push levels even higher, and side effects become harder to manage. The simple solution is avoidance. Most doctors and pharmacists recommend that patients on amlodipine skip grapefruit entirely. Other citrus fruits, such as oranges or tangerines, do not have the same effect. If you enjoy juice at breakfast, those are safer alternatives. So the bottom line is clear. What seems like a healthy fruit can quietly change the way your medicine works. If you are on amlodipine, avoiding grapefruit is one of the easiest steps you can take to reduce side effects and keep your treatment safe. The second food group that makes amlodipine side effects worse is high-salt foods. This includes obvious sources like chips, pretzels, and canned soups, but also hidden salt in bread, sauces, deli meats, and even breakfast cereals. Why does salt matter so much? Amlodipine works by relaxing the small arteries, which lowers blood pressure and eases the workload on the heart. But too much salt pulls water into the bloodstream. The body holds on to extra fluid, and this directly increases blood volume. The result is more pressure inside your blood vessels. That extra fluid ends up in the tissues of the lower body. It makes swelling in the feet and ankles, one of the most common side effects of amlodipine, even worse. Patients often notice their shoes feel tighter in the evening, or that sock marks around the ankles are deeper and last longer than before. For some people, this swelling can spread up the legs and make walking uncomfortable. Studies confirm that sodium intake is one of the strongest drivers of fluid retention. According to the American Heart Association, adults should aim for less than 1,500 milligrams of sodium per day for optimal blood pressure control. Yet most people consume more than double that amount, often without realizing it. The problem is magnified in older adults. Kidneys naturally become less efficient with age, making it harder to get rid of excess salt. When you combine this with amlodipine, the risk of persistent edema and discomfort climbs sharply. So what can you do? First, become a label reader. Check the sodium content of packaged foods. Many healthy options still contain hidden salt. Second, limit processed and restaurant meals, which are usually loaded with sodium. Cooking at home with fresh ingredients gives you much more control. And finally, try flavoring your food with herbs, lemon juice, or spices instead of salt. The takeaway is simple. Amlodipine already increases the chance of swelling. Adding a high-salt diet is like pouring fuel on the fire. By cutting back on sodium, you give the medicine a better chance to work, reduce discomfort, and protect both your heart and your kidneys in the long run. The third item on the list is alcohol. At first glance, a glass of wine or a cold beer may seem safe. But when you are taking amlodipine, alcohol does more than just relax you. It can quietly magnify side effects. The main reason is ethanol, the active ingredient in all alcoholic drinks. Ethanol dilates blood vessels and lowers blood pressure. Amlodipine does the same thing by relaxing the small arteries. When combined, these effects stack together, sometimes pushing blood pressure lower than intended. The result can be dizziness, lightheadedness, or even fainting. For older adults, this is especially risky because a single fall can lead to serious injury. But ethanol is only part of the story. Alcoholic drinks also contain other compounds known as congeners. These are natural byproducts of fermentation and distillation. Darker beverages, such as whiskey, brandy, and red wine, contain more congeners than lighter drinks. These substances increase flushing, headaches, and dehydration, which overlap directly with amlodipine's side effects. Another factor is sugar. Beer, sweet cocktails, and liqueurs carry high sugar loads. Sugar spikes blood glucose and insulin, and this promotes fluid retention. For patients on amlodipine, that means ankle and foot swelling. A side effect that may already be difficult to manage can become even worse. Red wine and some beers also contain histamine and tyramine. These compounds trigger flushing, headaches, and sometimes irregular heartbeats. If you already experience facial redness or pounding headaches from amlodipine, alcohol can make those symptoms stronger and more frequent. Finally, alcohol is a powerful dehydrator. It increases urine output, leaving the body with less fluid. This dehydration makes blood pressure more unstable and concentrates amlodipine in the bloodstream, so you may feel unusually weak, tired, or dizzy after even a small amount. What does this mean in practice? It means alcohol is not a neutral choice. Every drink carries a mix of ethanol, sugar, and other compounds that push amlodipine side effects further. For some people, a single drink with food may not cause obvious problems, but frequent drinking or drinking on an empty stomach can quickly add up to bigger risks. Most doctors recommend caution or avoidance. If you choose to drink, keep it rare, have it with a meal, and never combine it with hot environments such as saunas or summer heat, which magnify blood vessel dilation. The takeaway is clear. Alcohol and amlodipine both lower blood pressure. Add in sugar, congeners, histamine, and dehydration, and you have the perfect recipe for worse swelling, headaches, flushing, and dizziness. Cutting back, or avoiding alcohol altogether, is one of the simplest steps to keep your treatment safe and effective. The fourth item on the list is licorice. This herb is often found in candies, teas, herbal supplements, and even some cough syrups. Many people see it as a natural product, but for patients on amlodipine, it can quietly interfere with blood pressure control. The problem lies in a compound inside licorice called glycyrrhizin. This chemical changes how the body handles sodium and potassium. Specifically, it causes the kidneys to hold on to sodium and water, while at the same time lowering potassium levels. That extra sodium and fluid increase blood pressure and promote swelling. Low potassium, on the other hand, can make muscles weak and the heart more irritable. When you combine licorice with amlodipine, the effects work against each other. Amlodipine tries to lower blood pressure and reduce the workload on the heart. Licorice pushes blood pressure back up, makes swelling worse, and increases the risk of irregular heart rhythms. This is especially dangerous in older adults, who may already be taking other medications that affect the kidneys or potassium. Clinical reports show that even moderate amounts of licorice candy or tea can raise blood pressure in sensitive patients. The effect can last for days after the licorice is eaten, because glycyrrhizin stays in the body for a long time. Some patients are surprised to learn that their hard-to-control blood pressure is linked to daily licorice tea or herbal remedies. So what should you do? The safest step is to avoid licorice in any form if you take amlodipine. Check labels for licorice extract or glycyrrhizin in teas, lozenges, and candies. If you enjoy herbal drinks, consider safer alternatives like ginger or chamomile, which do not interact with blood pressure medicine. The bottom line is that licorice is not just a sweet flavor, it is a biologically active herb. For someone on amlodipine, it can undo the benefits of treatment, worsen swelling, and raise blood pressure back to unsafe levels. Avoiding it is a simple but powerful way to keep your medication effective. The fifth item on the list is high-fat meals. Think of fast food, fried dishes, heavy cream sauces, or large portions of cheese and red meat. These foods don't just affect cholesterol or weight. They can also change the way amlodipine works in the body. Here's why. When you eat a very fatty meal, digestion slows down. The stomach empties more slowly, and the intestines take longer to absorb nutrients and medicines. For amlodipine, this delay means the drug enters the bloodstream less predictably. Blood levels may rise more slowly at first, then peak higher later than expected. That fluctuation can make side effects more noticeable. Patients sometimes report stronger flushing or dizziness after a heavy meal compared to taking amlodipine on a lighter stomach. In others, swelling in the ankles seems worse on days when high-fat foods are eaten because circulation is already under more strain. There's also the issue of weight gain. High-fat meals are calorie-dense, and regular overeating contributes to obesity. Extra body weight increases the workload on the heart and makes swelling and high blood pressure harder to control. It also raises the risk of diabetes and kidney disease, two conditions that complicate amlodipine treatment. Clinical studies support this. Research on calcium channel blockers, the drug family that includes amlodipine, shows that high-fat meals can alter drug absorption by up to 20 to 30%. This doesn't sound like much, but for patients already sensitive to side effects, even small changes in blood levels can tip the balance. So what should you do? The goal is not to eliminate all fats, but to choose the right kinds and keep portions balanced. Healthy fats from fish, nuts, and olive oil do not disrupt amlodipine the same way a greasy fast food meal does. Spacing your medicine and your heaviest meal a few hours apart may also help smooth absorption. The key message is simple. High-fat meals make amlodipine less predictable. They increase the chance of dizziness, flushing, and swelling, while adding long-term cardiovascular risks. By shifting toward lighter, balanced meals, you not only reduce side effects, you also protect your heart, kidneys, and overall health. The sixth group to watch out for is stimulants, especially caffeine and energy drinks. Coffee, tea, sodas, and energy beverages are a normal part of daily life for many people. But when combined with amlodipine, these stimulants can push your heart and blood vessels in the wrong direction. Here's how it works. Amlodipine relaxes small arteries, lowering blood pressure and reducing the workload on the heart. Caffeine does the opposite. It stimulates the nervous system, increases adrenaline release, and temporarily narrows some blood vessels. This raises blood pressure and makes the heart beat faster. The clash between the two can leave patients feeling restless, flushed, or unsteady. Energy drinks are even more concerning. They not only contain high doses of caffeine, but also added stimulants like taurine, guarana, and ginseng. These compounds amplify the stress on the heart and can trigger palpitations, headaches, and jitteriness. Some energy drinks pack the equivalent of 3 or 4 cups of coffee in a single can. For someone on amlodipine, that sudden surge can completely offset the drug's blood pressure-lowering effect. Clinical studies confirm the risk. In trials, caffeine has been shown to raise blood pressure by 5 to 10 points in sensitive individuals. That may not sound like much, But for patients trying to control hypertension, it's enough to undo the progress of medication. When combined with amlodipine, the result is inconsistent blood pressure readings and more frequent side effects like flushing or headaches. Patients often describe a pattern. They feel fine in the morning, take amlodipine, and then, after a large coffee or an energy drink, they notice pounding in the chest, dizziness, or increased swelling by evening. These symptoms are not always traced back to caffeine, but the connection is real. So, what's the solution? Moderation is key. For many patients, a small cup of coffee or tea with breakfast is acceptable. But multiple servings throughout the day, or any use of energy drinks, is strongly discouraged. Switching to decaf, herbal teas, or water with lemon can provide a safe alternative without compromising treatment. The bottom line, stimulants fight against amlodipine. They raise blood pressure, increase heart rate, and worsen side effects like flushing, dizziness, and palpitations. Cutting back on caffeine and avoiding energy drinks entirely is one of the simplest ways to let your medicine do its job. The seventh and final group is processed and packaged foods. This includes canned soups, instant noodles, frozen dinners, deli meats, snack chips, and even many breakfast cereals. They may look convenient, but for someone on amlodipine, they can quietly magnify side effects. The main culprit is sodium. Processed foods are the largest source of dietary salt worldwide. Even a single frozen meal can contain more than a full day's recommended sodium intake. As explained earlier, sodium pulls water into the bloodstream and increases fluid retention. For patients on amlodipine, that means swelling in the ankles, and feet becomes harder to control, and blood pressure may rise again despite medication. But sodium isn't the only problem. Packaged foods often contain preservatives such as sodium nitrate, MSG, and phosphate additives. These compounds strain the kidneys, which are already under pressure in people with hypertension. Some also cause blood vessel irritation, which can worsen flushing and headaches. Hidden sugars add another layer of risk. Snack bars, flavored yogurts, and boxed cereals may look healthy, but often contain large amounts of added sugar. High sugar intake promotes weight gain and fluid retention, both of which intensify amlodipine's most common side effect, chronic swelling. Clinical data support this concern. Studies from the American Heart Association show that high consumption of processed foods is strongly linked with uncontrolled hypertension, higher rates of kidney disease, and worse cardiovascular outcomes. For patients on amlodipine, this creates a vicious cycle. The drug lowers blood pressure, but the diet constantly works against it. Patients often describe a familiar pattern. On days with fresh meals, vegetables, lean protein, whole grains, blood pressure feels stable, and side effects are mild. But after eating salty packaged snacks or processed takeout, swelling and flushing return quickly. So, what can you do? First, limit packaged foods as much as possible. Cooking at home gives you control over sodium and sugar. Second, check nutrition labels. Choose items with less than 150 milligrams of sodium per serving whenever possible. Finally, focus on fresh, whole foods like fruits, vegetables, fish, and legumes, which support amlodipine's benefits instead of fighting them. The bottom line is simple. Processed foods and amlodipine do not mix well. They add salt, sugar, and chemicals that magnify swelling, stress the kidneys, and reduce blood pressure control. Choosing fresh over packaged is one of the most powerful lifestyle changes to protect your health while on long-term treatment. If you've been taking amlodipine for years, knowing which foods make side effects worse gives you real control over your treatment. These are practical changes you can start today. Avoiding grapefruit, cutting back on salty snacks, limiting alcohol, and skipping energy drinks all make your medicine safer and more effective. If you found this breakdown helpful, give the video a like and share it with someone who may also be taking amlodipine. And don't forget to subscribe for more clear, evidence-based deep dives into the medicines you use every day. That way, you'll never miss the next update. For full references, check the links in the video description, including Mayo Clinic, NHS, FDA, and PubMed. We've gathered the scientific sources so you can read them for yourself. And just one final reminder. This video is for educational purposes only. It is not medical advice. Never stop or change your medication without talking to your doctor. Always work with your healthcare provider to make the best decisions for your health. That's it for today's breakdown. If you're on Amlodipine, don't miss our in-depth video on its top side effects. Click here to watch next. And for a broader look at blood pressure medications, explore the full playlist on your screen. It's the best way to stay informed and protect your health.